So picture this. A newborn has a pretty serious eye condition, but the cause isn't the eye at all. It's their skin. And get this, the best way to treat it is to pretty much do nothing. Sounds kind of crazy, right? Well, we're going to dive into neonatal ectropion in Harlequin ichthyosis. It's a rare condition that teaches us this incredible lesson about how sometimes gentle, supportive care is way more powerful than jumping in with aggressive treatments. Okay, so here's how we're going to break it down. First, we'll get to the bottom of what's really causing this. Then, we'll look at the actual danger it poses to the baby's eyes. After that, we'll walk through the super gentle management plan, and you'll see why sometimes less is absolutely more. And finally, we'll look at the really hopeful path to improvement. All right, so first things first. To understand what's happening with the eyes, we actually need to forget about the eyes for a second. The real story here begins with the skin. That's the powerful underlying force that's driving everything. So what is Harlequin ichthyosis? It's a severe genetic disorder. Basically, babies are born with these thick, kind of diamond-shaped plates of skin all over their bodies. And the key thing to understand, the most important part, is that this skin is incredibly tight and inflexible. Think of it like a suit that's way, way too small. That tightness, that's the whole issue right there. And that brings us right to the eye problem. See, this condition is called neonatal ectropion, and all that means is that the eyelids are turned outward. But here's the kicker. It's not an eye defect. The eye itself is fine. It's purely a mechanical problem. That super tight skin we just talked about is literally pulling the eyelids down and away from the eyeball. It's like an anchor, exposing the delicate inner surface that should be protected. Okay, so the eyelids are being pulled away from the eye. You might be thinking, so what? Well, it's a huge deal. What does that actually mean for a newborn's health, for their vision? This isn't just a cosmetic issue. This simple mechanical problem creates a whole cascade of very real, very urgent dangers. So that really begs the question, right? If the eyelids aren't doing their job, what's the single biggest threat? What's the number one thing we have to worry about? Think about it. Your eyelids are like windshield wipers for your eyes, right? They blink, they keep things moist, they protect the surface. But in this case, that shield is just gone. The cornea, the clear front part of the eye, is left wide open to the air. And what happens? It starts to dry out big time. And that can lead to all sorts of nasty stuff. Painful abrasions, inflammation, something called keratitis, and yeah, even complications that could threaten the baby's sight for good. So protecting that cornea becomes priority number one, hands down. Okay, we've laid out the problem, and it sounds pretty serious. So let's talk about the solution. And this is where the story takes a really interesting turn, because the treatment is surprisingly, gentle. It's all about supportive care. Yeah, this quote right here, it says it all. The mainstay of initial management is just frequent artificial tears and lubricants. I mean, think about that. The core treatment isn't some high-tech surgery or a cocktail of powerful drugs. It's just eye drops. Lots and lots of them. The goal is simple. Do the job that the eyelids can't, and keep that eye surface constantly moist. So the whole strategy really comes down to these three simple things. Step 1, lubricate, lubricate, lubricate. We're talking nonstop moisture. Step 2, you get the experts involved. An ophthalmologist comes in to guide the whole team in the NICU. And step 3, you watch and you wait. It's all about careful monitoring, just keeping an eye out for any problems and tracking how things are getting better on their own. And this leads to what I think is the most fascinating part of this whole story. It's this idea that, in this case, less is more. It's not just about what you do, it's about what you don't do. It's all about actively avoiding stuff that could actually make things worse. So on one hand, you've got the standard of care, lubrication, supportive care, monitoring. Simple. But the what to avoid list is just as crucial. Surgery? Nope, almost never done in the beginning. Certain strong medications, like some steroid antibiotic drops? Not appropriate. There's no infections, so why use them? And this one is huge. You never try to manually pull or push the eyelid back. You could cause a real injury. The entire philosophy is just to protect the eye and let the body do its thing. So, you do all this gentle, supportive stuff. You avoid all the aggressive interventions. What happens next? Well, the long-term outlook is actually really, really good. The path forward is pretty amazing because the body itself starts to take the lead. Let's walk through the timeline. At birth, okay? The ectropion is there. It's a direct result of that tight skin. Then, in those first few weeks, the neonatal period, it's all about lubrication, just keeping things safe. But here's the beautiful part. Over time, as the baby grows, that super tight skin starts to relax, it becomes less taut, and as that happens, the eyelids just start to go back to where they belong. In most cases, the whole thing gets so much better all by itself. So the main takeaway here is just how positive the prognosis is. It's really hopeful. With this simple, supportive plan, the condition usually stabilizes and gets better without any invasive procedures. Now, that doesn't mean you just forget about it. Long-term follow-up with a specialist is, of course, absolutely necessary to make sure everything continues to heal properly. And that kind of leaves us with this one big question to think about, doesn't it? How does managing such a rare, intense condition teach us about medicine in general? I think it shows us the incredible power of supportive care over aggressive intervention. It's a perfect example of how sometimes the smartest thing to do is to trust the body's amazing ability to heal itself. It's a powerful reminder that sometimes patience and gentle care aren't just an option, they're the best medicine we've got.